Are you struggling to grow and become a more profitable practice? Are you putting in crazy hours every week just to maintain current business? Are your advertising dollars being spent without any kind of tangible result or ROI? Well, if you answered yes to any of those questions, then keep listening, because we're going to show you a time-tested formula that, when implemented, will help you generate an additional $250,000 to $1 million annually. No kidding. Here are 3 things we're going to cover today. 1, introduce you to this innovative marketing strategy that generates consistent results every time we implement it. Give you an idea of what it involves, the time, the investment, and specific results you can expect. And 3, to see if this formula makes sense for you and how it could help you achieve personal and business objectives, not only financial security, but the freedom to spend more time doing the things that you've always wanted to do.
Yeah. Yeah, baby. Yeah.
Sound too good to be true? Well, just wait until you see the results. First, a little bit about ourselves. Specializing in medical practice growth, the PMA Group is a full-service advertising and marketing firm. We're located just outside Buffalo, New York. We were established in 1986, and some general services we provide are market planning, print, radio, and video production. We also do media buying, informational seminars, along with website design, programming, and SEO. Over the past 5 years, we have focused on the medical industry. We currently provide advertising and marketing services for dental practices throughout the country and Great Britain, Zimmer Orthopedics, Western New York Spine, Southtown Surgical, Vascular Associates, Buffalo Optical, and Just Do It Dental, to name a few. However, the product we develop that will set your practice apart from the competition is our Patient Seminar Blueprint. This has become a real game changer. Here's a short video clip that tells the story of how this all started and the significant results it has generated.
Hi, I'm Dr. Scott Westermeyer. I've got a little practice outside of Buffalo, New York, which isn't exactly Los Angeles. And over the last several years, you probably have experienced what I have, a little economic downturn, which has been challenging in dentistry, especially if you have a dental practice that provides a lot of elective services, which is what took the biggest hit in that downturn. The reason we put this together is to share with you a little secret of how we've been able to maintain and actually grow through these hard times, employing a technique in our practice that's paid off real well for us. And I'd like to tell you a little bit of the background story before we show you exactly how it is we do what we do. A couple years ago, when the recession really kicked in, I caught myself outside of dentistry trying to hit a home run in real estate. And maybe you've been in the stock market or somewhere else, but this was my little tripping point. I'm 52 years old, I was feeling the heat, and I felt the need to make some money outside of the practice for some reason. And so I got involved in a few deals that really cut me off at the knees. And the reason I tell you that is I found a need to, once I decided that wasn't going to work, I came back to the practice and I said, okay, let's get serious about this dental practice. We've experienced a moderate success here. I want to take it up a notch. And so we started to think, what is it we could do to really improve our practice? Now, we had a pretty solid 10-chair practice out in the suburbs of Buffalo, and we were clicking around okay, but what I noticed was every now and then we would hit streaks of production where we would do real well. And we measure our hourly production, and we would pop up at about $2,000 an hour, and that's pretty good. But the trick was we couldn't maintain that all the time. So in getting down to dirty about how to do this, we said, how can we change this? And we decided we just have to invite more cases in that pay better. And what were those? And frankly, that was my higher-end cosmetic stuff, and which was falling off, right, because that's elective. But the other thing that seemed to be clicking along pretty good was implants. It's a growing area, and the market was getting more attuned to that, so patients were starting to ask about them. There was still some confusion about them, but we know that when we do implants fast and efficiently, they're very profitable. So we also took note of the fact that when it came to implants, we took a lot of time explaining the pros and cons, the ins and outs of implants, and if we could do this more efficiently, it would be to our advantage. So we kicked around an idea that had been used by local ophthalmologists. Around here, LASIK surgery, the ophthalmologists invite patients to come into their office and witness a LASIK surgery and sign people up. And they were very successful at it. So my wife, among others, had been harping on me, why don't you try that? And I used to think people wouldn't be interested, but now I had a different reason. I said, let's try this. Let's invite some people in and show them a little movie and tell them a little story and take an hour to show them the miracle of what implants can do. And we did. And we screwed up the first couple and had some hits and misses, but we were onto something because people appreciated the clarity that we were giving them about implants, and what they were doing is stand up, turn around, and wanting to schedule consults with us. And while that was our aim, we weren't good at doing it just yet. So what we did was we spent some time at perfecting the actual presentation, and we learned to use testimonials and certain little educational aids, and we put together the whole thing and started doing this on a regular basis. And before we knew it, we were experiencing significant pop in our production to the tune of $50,000 and $100,000 worth of dentistry scheduled from these nights of seminars to patients. So I'm proud to say we popped our production on up this last year to $5.5 million. And I want to tell you, these patient education seminars that we put on right in our waiting room have become a standard practice once a month in our practice. And last year they accounted for over 20% of the production of our office. And when we kind of came to the realization of how powerful these were and understood that actually the hour that we take to do that is the most profitable hour we have, bar none, in everything we do in the course of a month. I mean, the sales effect that happens that night sets us up and sets our schedule up and mines out 5, 10, 15, 20 cases that are high production cases that absolutely make all the difference. So now you may not be able to relate to these numbers, or you may surpass them, I don't know, but our practice now clicks between $400,000 and $500,000 a month, and a good portion of that, like I said, 20% of that is accounted for by implant-related dentistry. Now, a little serendipitous thing is when we do these seminars, new patients come in for all kinds of reasons. We call it collateral dentistry. They walked in the door wanting to learn about implants, but they end up getting dentures and partials and crowns and all the other collateral dentistry. So we count all that in that mix. That's where we get that number. But I'll take it. I'll take it because we're asking for and getting the high productive implant related dentistry. And here's another sideline we didn't know. We've kind of positioned ourselves in our marketplace as the experts because we're the guys that do those seminars. So when we have a little article in the paper or a little thing on the radio, we're now known for those guys that give the seminar, so they know what they're talking about. And while there's plenty of dentists around that do implants just as well as we do, we make more noise about it than anybody else, and as a result, get more traffic.
Our first seminar was February 2009. Well, that day a huge snowstorm moved in, but when 35 people braved the snow and the cold to attend, then we knew we were onto something. This strategy has attributed to major practice growth from 250,000 in 2009 to almost 1 million in 2012. And if we can do it here in Buffalo, New York, then there's absolutely no reason you can't achieve these results in your own city or town. Because of the enormous success these seminars offer, we introduced this concept to other medical professions, specifically Zimmer Orthopedics. Advertising was limited to posters, newspaper ads, and some radio, asking the question, do you have knee or hip pain? We then designed a custom multimedia presentation that included 37 slides with video. The results speak for themselves. 23 to 175 wanted to know more on how to alleviate knee and hip pain. Talk about a qualified customer. If these people took the time to attend a seminar, You know they are prime candidates for knee and hip procedures. Can you see how hosting these monthly patient information seminars can substantially increase your business? Here's the bottom line. Our patient education seminars consistently bring in 25 to 60 qualified leads every single month. Last year, Westermeyer Martin Dental Care used patient education seminars to deliver over $979,000 of additional implant production to their practice. Spending $96,000 in annual advertising costs, the ROI was over 1,000%. And although we don't have specific sales numbers for Zimmer, they have seen a substantial increase in sales. This is what we provide: a comprehensive seminar blueprint and project management system that includes seminar advertising, creative, media research, and placement designed to get prospective patients in the seats, print, radio, and TV production coordination, design ads, copywriting, script, etc. We work with your web company to list seminar information on your website. We provide seminar checklists to keep you and your team on task. This includes a seminar project list to track and ensure project deadline adherence, the creation of customized multimedia presentation for the seminar, weekly scheduled coaching sessions, phone, email, Skype. We make ourselves available for any additional questions and coaching. Systematic follow-up procedures to seminar participants. We also customize your program in case you want to take some of the responsibilities in-house. We'll work with you to make sure all details are covered and nothing is left to chance. So, if you're looking to take your practice to the next level, become this specialist that sets you apart from your competition, call or email the PMA Group today. This time-tested formula is working right now for other dental and medical practices all over the country.